Good afternoon. How are you?
Good afternoon.
All right. So my name is Meet. I'm of the FMP student, and today we're gonna do the abdomen assessment.
Okay.
And do I have consent to take a video for my instructor to check this out?
Sure.
All right. Wash my hands. I did the hand hygiene. So before we start the abdomen assessment, there are four things that need to be taken care: is inspection, auscultation, percussion, and palpitation. So we'll start with the inspection. So by seeing abdomen looks normal, uh, the skin looks according to the ethnicity. The sclera is white and there is no yellow discoloration, so there is no jaundice. Abdomen is round, well defined, no stretch mark or no any open wound or anything. So that looks good. And umbilical is right in the middle of the abdomen. The second thing we start is auscultation. So I'm going to take my step and start listening abdomen. So we're going to divide the abdomen into four quadrants. I will start my auscultation from left lower, from the right lower quadrant, then we'll go to right upper quadrant, then we go to left upper quadrant, and then left lower quadrant. All sound heard? Good. Go to right upper quadrant. Yes, all sound is normal. Go to left upper quadrant. Good all sound. And I'm at the left lower quadrant. Okay. So bowel sound is normal, but in all four quadrants. Now I'm gonna listen for uh, aorta, aortic artery, then iliac artery, renal artery, and the femoral artery. So no brute heard, renal artery, we've got the iliac artery, and we're gonna go to femoral artery. No bruise or any bruising sound heard. Now we're gonna do the percussion. So we'll start percussion just like we started the auscultation from the lower quadrant to the upper quadrant. So this is my dominant hand, so I'm going to use that right hand. Here where I hear the dull sound, I'm going to go more upper. And this is where I heard the dull sound. So from here to here is probably around like 7 centimeter. That's a normal size of the liver. And the same thing we're going to do on the left upper quadrant to feel for the spleen. So the right upper quadrant liver could not be able to palpate, auscultate, only the border, and we're going to go on the left upper quadrant. So normally we start with the 12th rib and go up to the 10th rib first, 12, 11, and 10, and then we'll start auscultating. I don't feel any spleen, so that's a good sign. So there is no splenomegaly and no hepatomegaly. So the same way we can go and check for another quadrant, the lower. Bladder sound distended. So here we conclude our percussion. Now we go for our last stage is palpitation. So normally before we palpate, always make sure your hands are warm because you're gonna touch the patient. We start the soft palpitation first, and then we go for the deep palpitation. Same way we go for lower quadrant, upper quadrant, and then the left upper quadrant and left lower quadrant. And normally with the soft palpitation, we just try to see if the patient feel any kind of pain or tenderness. Any pain? So soft palpitation, patient did not feel any pain. Now we'll go deep palpitation. If you feel any pain, just let me know and I will stop. Okay. So normally some people use one hand, but two hand is always good, so you can able to give some more pressure and see that. And while we do the palpation, we'll try to feel for the liver in case we can find any enlargement, anything. And while we're doing that, we can even check for the other tests that we're gonna do in the video. So we conclude here our palpitation. So let's do the 4 specialized tests that we do. The first test we're gonna do is to check for the polythiasis, which is called Murphy sign. So if the patient feel pain, means a positive Murphy sign. So I'm gonna palpate you a little deep, and you let me know if that hurts. Okay. And can you take a deep breath? Okay, very normal. Any pain? No pain. Means patient doesn't have any polythiasis and Murphy sign is negative. So that was the first test. Now second test we're gonna do is the wave test, which is we do for the ascites, for the fluid collection in the body. So normally we'll ask patient if they can participate to help us out to do the test. If not, you can use your other hand and then you can check for that way. But here patient is alert, awake, so we can ask him to do that. So what we're gonna do is that we're gonna put your hand like that on your tummy. Yeah, there you go. Okay. So and we're gonna put my hand here, and I'm gonna tap one side. I don't feel any waves coming towards this hand, so that means the wave test is negative. Same way we can do it other side. I will leave one inch away, and I don't see anything coming. So the wave test is negative, so that means there is no sadness. Thank you. The second test we'll do is so we did the Murphy test. Second was a wave test. Now we'll do for SOA test, which is we do for the appendicitis or the acute appendicitis. So normally we'll ask the patient to two way we can check that test is like I'm going to ask the patient to try to lift his leg. Try to lift your leg. Okay. Does it hurt? No. So there is no pain at the thoracic muscles here. So that's all it says. Patient doesn't have any appendicitis there. Another way we can test the same thing is that we'll ask the patient to turn to the left side of me. Can you turn towards me? And we try to take this leg and extend away from that body. Do you have any pain? No pain. So patient denies any pain means we can come back to comfort. Yeah. So SOA test is negative. Patient doesn't have a appendicitis. And the last test, specialized test we're doing is CVA, which is we're doing to find out if the patient has any kidney disease, which is polynephritis. So we'll ask the patient to have a seat at the edge of the bed. Can you sit here, please? Yep, and we'll ask them to lift this shirt up a little bit, and this is where the kidney is. So we tap them slowly. Do you have any pain? No. So patient denies any pain means patient doesn't have any kidney inflammation going on. If the patient would have pain, that will give us indication that patient has any kidney disease. So our test, here is our test concluded. So we covered here our basic inspection. auscultation, percussion, and palpitation, and four different specialty tests. Thank you so much for letting me do the test. Thank you so much.